Hi, I'm Dr. Sherilyn Driscoll. I'm a pediatric physical medicine and rehabilitation physician at Mayo Clinic. And I'm here with Dr. Bob DePompolo to talk with him a little bit about his role on the American Board of Physical Medicine and Rehabilitation and some of the other things he does related to Mayo Clinic.
Good morning.
Hi, Dr. DePompolo, could you tell us a little bit about your role on the board?
All right, I'm one of the board directors. There's 12 to 14 of us that serve on the board. We represent the general practitioners, and we help make decisions regarding what the direction the board will be going in. We have also an executive director and a number of members of the staff office, which most, I think, physiatrists are aware of, because you have to take your board exam and you have to maintain certification. But each of us have a certain responsibility on the board, and it usually falls into either being on the oral exam part of this, developing that exam, or the written exam, which would be developing the written exam. And then most of us also participate with the maintenance of certification process for the board.
So is the board primarily involved in the certification of physicians, or are there other roles that the board has in influencing the direction of our specialty?
Its major task is the certification and making sure that the public is protected, that if you are a board certified physiatrist, that there's a certain level of ability or expertise. But I don't personally think that we drive the specialty as much as the specialty drives us. The academy, for example, is more the practice wing of our specialty, and the board is really more responsible to, for example, change our exam if the practice moves in a new direction, such as the introduction of ultrasound. That 10-15 years ago would never have been on our exam. But now we have to make sure the exam continues to evolve to test our candidates in the areas of practice we feel are general practice.
And your role on the board is a big commitment for you. It's a long-term and a fair amount of work. Could you tell us a little bit about that?
Well, we each commit to at least 6 years, and then most of us, if not the majority of us, do another 6 years. So it is a long haul. The beauty of that is there's a certain amount of history that you have to have, an understanding and a continuity, and we all sort of rotate off at different times, so the board is constantly changing by one or two members at any one time, but the majority of us are fairly constant, so that we remember why we did what we did and what direction that we're trying to set.
And how does the board differ from, or how does it work with the American Academy of PM&R or the AAP?
That's a good question, because there's a lot of confusion as to what each of these three organizations do. The board really is more the certification part of this. The practice itself is more the academy, and then the American the academic piece is the AAP, which is usually those that are more involved with the teaching and the academic side of things. So we each have a role, and we certainly do influence each other, and actually we meet together, but we're also separate, and we have to stay separate because we do have different responsibilities. As I was saying, ours is to the consumer, to try to maintain protection of the consumer.
Okay. Now, in addition to your role on the board, I know that you have also taken responsibility for something related more to Mayo, and that's the Krusen Society.
Yes.
Could you tell us a little bit about what that is and where that's going?
Okay. Well, most people know that Frank Krusen was one of the founders of the specialty, and we feel a particular kinship with him because he was our first chairman of our department. We're not the first academic department in PM&R, but we're close to one of the first. And so when we were looking at how to organize our alumni association, it seemed reasonable to use Frank Krusen's name on that as a way to recognize him. And it's a way for us to maintain some fellowship with our alumni, and to provide them some service as they get out into practice, because some of them are in academic practice, and we can provide some support to them.
And so speaking of that support, what exactly is the direction of the group, or how do they support the alumni?
Well, it's just fairly new, so we're just a couple years into this, and I think there's two major pieces to this. As I was saying, part of it is just collegial, staying in touch with each other, and part of it is to provide some educational support. And we put on at Mayo a wide variety of CME types of activity and non-CME activities that are already digitalized and available. And with the new electronic world we're living in, the goal we have is to figure out a way to help provide that to our alumni that are out in private practice who might find that very useful.
And I think you have some events going on today, right?
We do. This afternoon or this evening, before our alumni reception, we do have a business meeting for the Krusen alumni.
All right, great. Thank you.
You're welcome.